All right, everyone. Hello. This is now day 61. Today is the 2-month date, but it is 8.5 weeks. I like to go by weeks only because that's what all my paperwork says. Although the therapist today said, oh, today is 2 months, which she's right. Today's the 27th. I haven't posted the last couple weeks, but I do have some footage that I'll show for you either before or after. I don't know. I'll show it at some point during this video here, and kind of show you really what we've been doing in physical therapy. I have stopped filming while I am in physical therapy simply because I now am using 2 arms to do a lot of the exercises. So to sit there and hold the camera, I'm no longer just laying on a table. And I don't feel comfortable, maybe getting other people in the background. I really just don't want to make everybody else feel uncomfortable. So my intent was to come home and do the exercises here and show you. I've been doing my exercises, but I've just been too lazy to set the cameras up and film it, really is what it boils down to. So today I'm going to show you everything that I've done over the last 2.5 weeks. I think my last post was day 40 and this is 61, so I guess that's 3 weeks. So let's go ahead and get started. Really, I saw the doctor on the 18th, so that was 9 days ago. He asked me how I was doing in physical therapy, and I said, well, really they're waiting for your sign-off to go ahead and start the active assisted range of motion, or AAROM if you see that on your paperwork. The PROM is passive range of motion, which is what you see in my previous videos of me laying on the table of her moving my arm. That's passive range of motion. I'm not supposed to be doing anything. It's all her moving it. So when I told him that, he said, I don't know why they are not having you move forward with some active assisted stuff. He said, so I'm going to go ahead and make a note here, take this paperwork to him. The long and the short of it is when I went on Wednesday following my Monday appointment with the doctor, I started right in on the wand exercises, and Monday, I started the pulley system. So I plan on showing you a few of those things, but the first thing that they had me doing when I got out of the doctor's office and I went Wednesday was some isometric. So bear with me. I apologize for the camera angle you're going to see. I really just don't have a good spot to set it up. So I'm actually going to hold it while I do it. But it's all isometric stuff, and really you're not trying to move the arm, you're just trying to flex the muscle. So I'll show you that now. So really what we're doing, what they have me doing, is just against the wall, taking my arm and bending it at 90 degrees, putting my back against the wall. Every time I go, the doctor says, or the physical therapist says, try to pull your shoulder blades together. Don't slouch forward because you'll lose some of the stability that your back muscles provide to your shoulders. So really and truly try to focus on putting your shoulder blades together. So when I do that, I try to rotate the shoulder blade in, and I put my elbow against the wall and just press. And you press, and I do like a 1 through 10, and then I rest for 3 to 5, and then I do it again, and I do that. She said a set of 10 for each one, and you can do this twice if you want. You can do this up to 2 times a day. But you really want to do about 50% of your total overall strength is what she told me. So I press and hold for 10, I release for 3 to 5. Once that is done, I then move and stand with my shoulder directly against the wall, the operated shoulder, and my elbow against the wall. And she said, again, we're not going for movement here, we're going for the muscle tension. Make sure your muscles contract. So just like this, you try to push away from the wall. And again, I'm not really moving. You can see the shoulder move just a little bit as I do this. But I'm trying to push just to get that muscle to flex, hold for 10, release 3 to 5, and do that 10 times. Once that's done, I then face the wall and put my fist against the wall with my arm still at a 90-degree angle to my body. So the elbow's not super far out or super far back. It's kind of right in the middle. And then I just press and hold again for 10 seconds, rest 3 to 5, and do that 10 times. When that's done, then I have to move on to some internal and external rotation. And really what that is I put my wrist against the wall. I'm just using this because it's easier. Put my wrist against the wall with everything still 90 degrees, shoulder blade back, and try to rotate the arm inwards. That's really what you're trying to do. Again, push, hold for 10, rest 3 to 5. I'm not trying to pull myself around. I mean, I am trying to, but I'm making myself not do it. Again, using 50% power. Once that's done, I go on the other side and I try to do an external rotation. This is the one that hurts the most. Everything's still 90, shoulder blade back, and try to rotate the arm out, hold for 10, rest for 3 to 5. Those are the isometrics that I've been doing really over the last 10 days, or week I should say. So there hasn't been a whole lot of change since day 40 to day 61, other than the last 7 days. So the isometrics were the first thing that they had me do. Then she had me do some wand exercises, so I'll show you those now. I have this, it's a paint roller extender. I love it because it's got a cushion handle. Otherwise you just go get a wooden dowel or anything like that. You can use a broom handle. I think those are a bit thin. I like the thicker, or the thickness of this. It allows me to get better pressure on it with how I know it's not going to break. When I started this, she was moving my arm to 90. And that was it. You know, I had the elbow bend and she was moving the arm to 90, and that was really all that we were supposed to do, or they felt comfortable doing it. Now, she said, take it up and bring it back to wherever you feel comfortable. And right now with me, that right there is about as far as I feel comfortable going. There's a lot of pressure in the shoulder. I can kind of feel the bone against the floor, but we measured everything today and I have 135 degrees of movement, of rotation. So if this is 0 here, down flat with the body, I then raise to 90, and then from 90 I can go even further to 135, is what she measured it at. I love it. I think it's great. I will say that it is a bit difficult once I get all the way up here. There's a whole lot of pressure in the shoulder. It doesn't hurt until I try to pull it back down. From the topmost part, when I try to pull it back down, there's a bit of a pain in the top of the arm bone, it feels like. But she said that's everything that was fixed, getting used to moving again and getting used to moving the proper way. So that's that. They also have me doing, and I like to extend it for this, some abduction, or in other words, your arm is moving up and away from your body. So I extend the pole, I put the tip or the butt of the pole on the ground, I put my hand on the ground, and I just push my hand along the floor. Again, trying to keep my shoulder blade back and go out to where I feel comfortable, which for me is about right there, which is just shy of 90, I think. It's tough for me to tell. She didn't measure this one, but to keep my shoulder blade and my form right, I think it's just shy of 90. And then the last exercise that they had me doing with the wand is elbow usually on something raised like a pillow or a rolled up towel or something, but I didn't just put it on the ground here for this. I put the butt end against the palm of my hand and wrap my hand around it, and then I just push outwards to get some external rotation. This is, like I said, the most painful. The reason this is the most painful is because of the rotator cuff muscles. She said it has nothing to do with the shoulder innards, i.e. all the repaired stuff, the labrum and the glenoid and all that stuff. She says it has nothing to do with that. That's not the pain that you feel. The pain that you feel are all the very small rotator cuff muscles that haven't moved really for the better part of 5 months. I hurt myself March 9th, so coming up on 6 months. But she said those are the ones that hurt. But she did measure my external rotation, and I'll see if I can get a better shot of this for you, but she says I get about 30 degrees of external rotation. Let's see if I can bring this camera around. I'll show you guys. That should be good. So if this is neutral or 0, right there is neutral, 0. If I can push, you can see how I can get some external rotation out of it, and right about there the pain is getting to the point of being unbearable. So she measured that at 30 degrees. Now I think that's fantastic. I was watching another video, see if I can get this right. Hello7027 is the username of the individual who went through the surgery in October of 2011. And he said he is having difficulty getting any external rotation. And now I'm getting 30 degrees at week 8.5, really. Something else that he said was that he wasn't sure he'd ever get it back. The doctor told him, you may never get it back. Now again, he had a remplissage procedure, which I did not have. But still, that's something interesting to hear from the doctor, is that you may never get external rotation back fully in that arm. So again, these are the 3 motions that they're having me do with the wand. And the focus is to try to keep your shoulder blade back and keep good form. We'll talk about, before I show you the pulley system, which I'll show you after I'm done with this, here I have to hang it over the top of a door. I can show it to you. It's very simple. I actually bought it right from the physical therapy office. I could have probably made one for cheaper than what I bought it for. It was 15 bucks, but for 15 bucks I could spare it, so why not? To hang it on the door, I just take this piece here, hook it over the top of the door, shut the door. That's it. This holds everything, and then I can use the pulley system. And I'll show you that once this is concluded. Milestones. Let's talk about milestones. In a video I did, I want to say it was in the 20s, day 20 something, I talked about where I would want to be. Well, I watched that video the other night, and the reason I watched it was because in the Hello7027's video series, it took him 12 weeks until he noticed he could wash his hair with both hands. So when I set my goals, I said, okay, well, I think it'll take me about 12 weeks to wash my hair with both hands. That's not the case. I can actually pick my hands up, and I mean, you can see the difference in the shoulders. I can only go to here with this one. It doesn't hurt, I just literally can't move it. But I can get up here and I could wash my hair with both hands. Putting socks on was a huge milestone. Being able to tie my shoes was a huge milestone. Those came right around that week 5 area or time frame. This just happened week 7, I think it was. It was right before or right after I went to go see the doctor. So it was week 7 and a half, somewhere in there. I noticed I could wash my hair with both hands without having to bend forward and trying to use the arm that way. What else? Milestones. I can put deodorant on now with my operated hand on my operated side and my non-operated side. That was something, just reaching across your body, doing simple things like that was something that I didn't think would be difficult, but it turns out was one of the most difficult. So before I was having to use my right hand to put my deodorant on. I can also now, again, it doesn't hurt, I just can't move it. I can touch the top of my right shoulder so long as I bring my right shoulder forward to do it. If the right shoulder is just normal, I guess I can barely reach the collarbone or the AC joint. Going behind my back, I can, with this arm, this is the good arm, or the non-operated one, I can do one of these numbers, but with the operated arm, again, it doesn't hurt, I can't do that motion. That's as far as I can go. So, I mean, there's a huge, huge difference. So I can't tuck my shirt in, I can't reach something in my back pocket. I can, but it's extremely difficult and I have to move the arm kind of in a funky way to be able to do it. The physical therapist said the motions that you do, because I asked her today, I said, should I focus on strengthening the muscles or getting the range of motion? Pretty much knowing the answer, but she said focus on range of motion, but focus on proper range of motion. Don't push yourself past the point of fatigue to where your body is trying to compensate with other muscles or getting the hand into a different position by using a different way of doing it. She said that's going to really upset the biceps tendon that runs basically down the middle of my shoulder, but also it could hurt other things and really not help with stability. Sleeping, the doctor said no more sling. When I went and saw him 9 days ago, he said, get rid of the sling, lose it, don't ever wear it again. So when I came home Monday night, I was all happy. I can finally sleep on my stomach. I'm a stomach sleeper. I was very, very hesitant to do that, and I actually found myself waking up on my back. So maybe the last 7 weeks leading up to that had trained me to become a back sleeper. I don't know. I really don't care either way. As long as I sleep good, that's all I care about. When I wake up in the mornings, without that sling on, the arm can basically do whatever it wants. Now, I've been dealing with shoulder dislocations for 8 years, so I understand and have trained my body to guard against it, which the physical therapist hates. But when I sleep, I always sleep with my left arm either down or by my side. My elbow never goes above my shoulder. It never goes back. So when I wake up in the mornings, this one could be in all funky, situations or places or positions or whatever, and it could be numb for my head laying right on it or whatever. But when I wake up, this one's fine. The only catch is it's sore, and it's that biceps tendon that runs right down the middle of the shoulder. I think also some of that might be the working of the muscle, but also the fact that it was numb for so long. The last thing that I'll show you that I've been doing in physical therapy that she has told me do not do at home. We just did it today, it was the first day, but I'm going to do it for demonstration purposes only. So I plan on doing maybe 1 or 2 reps of this. So bear with me, I'm going to pull the couch out into a bed so I can show you. All right, so the last 2 exercises that I'm going to show you before the pulley system was stuff that we did today, again, that I'm not supposed to do at home yet, but it's really fighting against gravity. So all it is, the first one is laying on my side, my unoperated side, with my operated arm just 90 degrees parallel. And all I'm supposed to do is keeping the shoulder blade back. I mean, you can see the difference from this angle, I'm sure. With the shoulder blade forward or shoulder blade back, there's a huge difference. She says what we're focusing on is the back muscles, again, that stability. And going from an internal rotation to an external rotation, but really focusing on the back muscles. So it's from this position here, rotating up and focusing on pulling back, I don't even know what the muscles are called, but basically pulling the shoulder blades together and then letting go, and doing that 10 times. I'm only going to do 1 rep because I'm not supposed to do it at home. You wouldn't believe how difficult this actually is. And she says that people often ask, well, yeah, that's just an easy motion, give me some weights, I can do it with a 3-pound weight. It's hard. Believe me, I didn't think it was going to be that hard. The second one is while laying on my stomach, and this really isn't tall enough to do it, but you let your arm hang completely. And then from the hanging position, you just lift the arm up and back, and you do it 2 different ways. The first way is with the arm slightly bent, but you're not using your biceps to lift. Again, you're using that shoulder blade, whatever those shoulder blade muscles are, to get the arm up. And the second one is with the arm straight, so then you're trying to lift that up and just basically touch your thigh, and then let it back down. And I'm going to stop doing that because that actually fatigues me. I was only able to do 10 reps of that before I got to the point of fatigue. And I was incredibly surprised that it was that easy to get tired doing a simple motion like that. It was very odd feeling fatigued just simply by moving my arm from a forward motion to a backwards motion. However, it felt fantastic to just lay on my stomach high enough up to my arm could hang, and just the feeling of relaxation was great. When I first got there, I didn't tell you before, but when I first got to the physical therapist's office, they had me do the hand rowing machine. So it's like a bicycle, but you do it with your hands. She had me do 3 minutes of rotating forward, so coming into the body in the bottom and away at the top, and then 3 minutes of going backwards or toward the body at the top and away from the body at the bottom. So 3 minutes each of that. That was the warm-up, and then we moved into some other stuff. Last thing I'm going to show you is the pulley system. I'm going to shut this camera off and take the other one with me, and we're going to go, and I'll show you that. This part here just goes up and over the door, and then you shut the door, and that tension holds it in. Let's see if I can do it. Center it on the door. That's it. So the door's shut, and the pulley system is in. So the theory behind this is that you use the good arm, or in this case my right arm, to lift my left arm. She wants me to do it in 2 ways. One is out in front, and again we're focusing on shoulder blades back and just go to the point of resistance. And that's about as far as I can go with this one. And hold and let go. And you do this 20 times. Pulley system reseating itself. Do that 20 times. And then you move on to kind of more of a diagonal or a 45. And this one is going to be less. But you go up to the point of resistance. I mean, you can see how much lower that one is versus the first one. And the muscles are bouncing. You probably can't see it on the video, but I promise you the arm is spazzing out right now. Just the muscles trying to stabilize it in that, because the arm wants to come forward because it can go higher when it's forward. But to try to keep it at that 45-degree angle is difficult. Really difficult. Again, it doesn't hurt, it's just the muscles are so sore or out of use. And the last one here is the most difficult motion. Shoulder blades back, trying to lift it. That's all I got. Well, let's see if I can get a little more. The key, she says, to relax, breathe, and trust that your arm can move. Probably 60 to 70% of this is mental apprehension. And I get that. Like I said, I've been dealing with this for 8 years. So having had that long to understand what can happen when it does come out, why would you want to go through that? Why would you want to put yourself through that? So I guard against a lot of things, which is why the muscle, there's one muscle that she massages, and oh my gosh, does it hurt a ton. She barely touches it. And I'll show you that here in a second. But just knowing that I can actually move the arm without risking, dislocating it again is something I'm going to have to get used to. And that's all the Pulley system is. That muscle that I was talking about actually is just off the rib cage and in front of, I think this is the latissimus dorsi, I don't know. It's right in here, and it's not on it, but it's just in front of the lat on the rib cage, and it runs kind of like this. And all she has to do is barely touch it. There it is right there. All she has to do is barely touch it like I'm doing right now, and it hurts a lot. And she said that's your guarding muscle, as she calls it. So anytime something happens, you kind of pull your arm in. That's the muscle that basically pulls the elbow to the body and protects against everything. So we'll go back in the other room and I'll finish this up. All right, to summarize, this is day 61. This is exactly 2 months from surgery. This is 8/27, August 27th. It is week 8.5. I like to go by weeks. Physical therapist's office today went by month. This is the second month. Milestones, put your socks on is a big milestone with 2 hands. Trying to do it with 1 hand is difficult, 2 hands is a lot easier, that's a milestone. Tying your shoes, huge milestone. Being able to put deodorant on is something you don't think about, but when you are unable to do it, being able to do it is a huge milestone. So that's a big one. Washing your hair. Now I can wash with both hands, albeit it looks a little funky, but it can get done. Exercises, isometrics, elbow against the wall, fist against the wall, side against the wall, and then internal and external rotations. All isometric. You're not looking for, big crazy motions or anything. You're actually not looking for motion at all. You're just looking for muscle contractions. The wand exercise, which I showed you down here to get to where I am now, 135 degrees. She says I'm right on target with where I should be. External rotation, 30 degrees. Let's see if I can actually move it. Any myself. Let's put my shoulder blade back. See, I'm trying to remember all this stuff. Shoulder blade back. I can get some. Maybe 5 or 10 degrees of my own. I don't know. The abduction, or the movement of the arm like this, that I can get to without the shoulder coming up. Again, focusing on normal movements. I can get to about there. I mean, that's pretty big. I mean, yeah, I can go all the way up with this one, but That's huge for me. It's been a long time since I've been able to do that and feel good about it. Forward. Let's see how far I can go. Just past 90. 90 would be about here, so what's that? 105, maybe 100 degrees of movement. And then again, behind the back, I can't really do that. I showed you that already. It's been difficult, especially today with the new exercises. I think we're going to get into a lot more difficult exercises, and the last 45 degrees of motion this way, I think is going to be extremely difficult, and it's just a matter of time now before my muscles are strong enough to move the arm in a normal manner again. So stay with me. I'll try to keep posting. I'm going to try to be diligent on that, and I apologize for the length of this video, but I guess I'm trying to make up for really the last 2 weeks of not posting. So if you have questions, comments, whatever, ask. I'm getting a few from a few of you guys out there saying, hey, I just went through it, your videos are great, keep posting. I'm going to try to do that. If you do have questions, I've gotten a few already, ask them. I'll be more than happy to answer anything that I can, but I'm no expert. So wish me luck again, and I don't know, be safe. Don't do this to yourself. It sucks. You don't want